Hi class, my name is Heather Robinson and today I'll be talking to you about epilepsy. First, I just want to go over our outcomes. We'll be talking about the definition and statistics, causes, the different types of seizures and symptoms, and what you can do as a teacher, any triggers, how to diagnose and treat, and I will give you some resources at the end. Imagine this little girl's fear. She's just seen her sister fall on the ground and experiencing an epileptic seizure, foaming at the mouth, having convulsions and shaking. And this was actually me as a child, terrified finding my sister on the ground almost every other morning after awaking, having a seizure. So, what is epilepsy? First of all, it is a neurological disorder marked by sudden recurrent episodes of sensory disturbance, loss of consciousness, or convulsions associated with abnormal electrical activity in the brain. Epilepsy is a neurological disorder that affects 65 million people around the world and about 3 million in the United States. So some causes of epilepsy are caused by irregular brain activity. Possibly some people are born with a defect in the structure of their brain. It could be caused by head injury, a tumor, or stroke, or an infection. So we'll talk about the different types of seizures. There are 4 of them. We'll start out with formerly known grand mal seizures, now known as tonic-clonic seizures. This is the type of seizure that my sister experienced. Shaking, stiffness of the body, loss of consciousness, loss of bladder or bowel control, biting of the tongue, and sometimes foaming at the mouth. But as teachers, we need to know what to do in this situation. So if this happens in your classroom, you need to remain calm and reassure others that you are calm so they will remain calm as well. You don't want to hold the person down or try to stop his or her movements because you could really get hurt. You need to clear the area around the person of anything hard or sharp and loosen any ties around their neck or any type of necklace. If a seizure is lasting longer than 5 minutes, it'll need medical attention. So you need to stay with the student until the seizure ends. Absence seizures. These are not as terrifying and less visible, but basically the eyes may turn upwards and the eyelids flutter. So they're not as severe as the grand mal seizures, but these seizures can last normally about 10 seconds, and it causes a short period of blanking out or staring into space, and the person suddenly stops all activity, and it may just look like he or she is staring off into space or just has a blank look. But what you can do is you can document this and let the parents know, and they can go forward with a medical evaluation. So complex partial seizures last less than 2 minutes. Agitation will appear. It appears that they're awake, but they will appear awake and alert, but really no one's home. So eye blinking, facial grimacing, lip smacking, repetition of movements, disrobing, laughing, or crying for no reason. So what teachers can do, you can identify, if you know the specific trigger of a student, you can make sure to avoid it. For example, some people have strobe lights as a trigger, a specific trigger, or video games. So document the seizure and stay calm. Simple partial seizures last less than 2 minutes. You have abnormal muscle movement or sensory sensations, possible ringing in the ears, different types of taste, smell, or touch sensation. The person is alert and remembers the incident, but these seizures can be a sign that another seizure is coming. So you can clear the environment to make sure that it is safe. And the student could actually tell you, hey, something's going on. There might be another seizure coming. So then it may be a more severe seizure that would be coming. But the triggers, a lack of sleep, illness or fever, stress, bright or flashing lights, caffeine, alcohol, medicines or drugs, skipping meals, overeating, or specific food ingredients. Now, these are all specific to each individual. Each individual will have may even have ones that are not listed on this screen here, but the main one is lack of sleep for most individuals. For my sister, it was lack of sleep and the video games. She was not able to do the video games at the arcades. So, treatment and diagnosing it. To diagnose the seizures, you will need an EEG. And it checks for the electrical activity in the brain. It checks the electrical activity in the brain for patterns. Usually, and these are usually seen in absence seizures. However, the EEG is done for all types of seizures. The epilepsy is treated with medication. Some medication is lifelong treatment, and if you are older or a child with severe epilepsy, you are going to have, it'll be less likely that you'll outgrow your epilepsy. So, to close, I would like you to ask yourself some questions. Do you understand what epilepsy is and the different types? What would you do if a child in your class had a seizure? And what if someone in your family suddenly had a seizure? So back to the beginning, to conclude on my sister, she is now treated with medication and no longer has seizures as she has gotten older. So the community resources here, these are two fantastic websites. The bottom one provides teachers with strategies for working with students with epilepsy. And I hope everyone learned a lot about epilepsy, and have a great night. Thank you.